Hi, I am Dr. Vishwanath Gowriah, consultant pediatric pulmonologist. Today I am going to talk about the treatment of asthma. What are the medicine we are going to use? How they affect in the stages of asthma. So to start with, we use two type of medicines. One, the relieving medicine. That means you take it when the child is having a problem, like they have wheeze. You give this medicine, which is commonly used as Ventolin or Ventolin, which comes in nebulizer or the inhaled forms, which we will talk about later. The second medicine is the preventive medicines, which comes in two. One is the steroid or the cortisone, either the inhaler or the nebulizer form, which we use for the long time to control the asthma. And the second is the powder, which we commonly montelukast, which commonly used along with the steroid to manage the asthma or control the asthma for a long time. I want to make one point clear. Asthma, you can only control the asthma, you cannot cure the asthma. Hence, we need to use this preventive medicine for a long time till your doctor says so. So bringing back the airway differences. So this is the normal airway. To recap, this is the inflamed airway, which causes, if it is not treated, which will go into tightness and they produce mucus, which is blocking the airway. This is the stage where your child is suffering from wheeze. Wheeze yani or nafas mushkila, or breathing very fast, struggling to breathe. So this is the stage where you use the relieving medicine, that is the Ventolin or the salbutamol, either in the nebulized form or in the inhaled form, which will help in relaxing the muscle. So the muscle will become like this, so child can start breathing easily. But the irritation of the muscle is still there. Hence, we need to use the preventive medicine, which is the cortisone and the montelukast. The cortisone, either the nebulized form or the inhaled form you use, then you bring the airway like to the normal. So hence, we have to maintain the airway as normal. So we have to use the preventive medicine, that is the cortisone and the montelukast or the singular, in the regular every day, even when the child is well, to maintain the airway as normal. Hope it is very clear. So two medicine, one the relieving medicine, which we use when the airway is very tight or when the child is having wheeze. Second, we use the preventive medicine to maintain the airway, shifting the airway from irritability to normal. So hence we need to use the preventive medicine for a long time, and your doctor will decide how to reduce the medicine and how to stop the medicine or change the medicine depending on the response from the child. So as we talked before, there are two medicines, the relieving medicines, which we use during the child when he is having a wheeze, and the preventive medicines, which we need to use for the long time to control the asthma. As you can only control the asthma, you cannot cure the asthma. So the two main commonly used devices for delivering the medicine are, one, the nebulizer, which is commonly used in UAE, and the second one is the inhalers. They come in a different form, and the device which we use to deliver this medicine is the aero chamber, which come in two parts. You can wash, dip dry. There is no need to wipe or clean inside. So this goes like this. They come in different form with the face mask or even just the mouthpiece, which will go in the mouth. So when you are using this, any inhalers, either the preventive or the relieving, shake them well and that load it here and give one puff. This is the loading dose. And then when you are using the inhalers next time with the face mask, so you give one puff and this mask will go on the face. So the mask cover the nose and the mouth together, so that there is a good air seal, so that the medicine delivered in this device will get mixed with the air, and when the child breathing in, the medicine will go smoothly into the lungs and act on the airways where it needs to be acted on. So with each puff, you give one puff, and the child will breathe for at least 10 times. Means you give one puff, he will breathe counting one, smooth breaths, 1, 2, 3, like that, 7, 8, 9, 10. So with each puff, he will breathe for 10 times so that the medicine will effectively reach the lungs. So this is how you use the inhalers, and your doctor will be able to tell you how many puff of the preventive or the cortisone inhalers, how long you need to use, and how many puff you need to use in the day, morning once or twice depending on the child, and how many puff you need to use the relieving medicines, which is the Ventolin, when the child is having asthma. They will be able to make a judgment based on the child, and they will give the asthma action plan. Why we need to use the medicine with this device? Why can't we use the inhaler directly? To answer that, see, if you use the inhalers directly without using this one, the medicine will deposit in the mouth, in the lungs, and in the stomach as well. So we don't need the medicine going everywhere except the lungs. So if you use the medicine with the device, the medicine is getting deposited mainly in the lungs so that it doesn't go anywhere else, so that the child don't have any systemic effect from the effect of the steroids. So the benefit of the medicine will completely to the lungs only. So these are the various methods how you can use with the child with the face completely covered. This applies to even when you are using the nebulizer. The mask has to completely cover the nose and the mouth. There is no point in giving the nebulizer like this, because you are giving the medicine to the air or the atmosphere. So it has to be completely closing the nose and the mouth. So this is the reason why we need to use the inhalers with the aero chamber, or the nebulizer with the mask on into the mouth, completely covering the nose and the mouth when the child is breathing comfortably on mom's lap or anywhere watching the TV. Maybe the child has to be comfortably breathing. There is no point in giving these medications when the child is crying, because when the child is crying, the medicine won't go into the lungs. It will irritate the child more. So make the child more comfortable. Use this medication in whichever the form you prefer to use, either the nebulizer or the inhalers. The inhalers, you have to use it with the aero chamber. This can apply to children from age 0 to 18 years as well. Even the adults can use this one. Now, how do you monitor asthma? The children over 6 years of age can do a test called the lung function, or where you will ask the child to blow in and blow out, breathe in and blow out. Then you get a recording. The doctor will be able to assess with the recording to see whether the asthma is under control, and then they go on reducing the medicine or changing the medicine depending on the response from the lung function, which is very important for children over 6 years to undergo when you see a doctor at least 3 to 4 times in a year, if not more than that. That the doctor will decide how soon or how often they need to do the lung function to manage the asthma. Thank you very much.